Good morning, ladies and gentlemen. Welcome to day 2 of the Highlights in Medicine Conference. I'm Craig Hubbard. I think, check my name, yeah. Welcome to this morning's sessions. I'd like to remind our speakers this morning that there was class parties last night. So every once in a while, make a loud screeching noise and whatnot to keep everybody awake. So that'll be good. I'd like to call on Florence Wardell to introduce our first speaker of the morning.
Thanks, Craig. Good morning, everybody. I'm glad to see everybody did survive the parties last night. I'm Florence Bruce Wardell from the class of 1978, and it is my pleasure to introduce my brother-in-law, Gaylord Wardell. Gaylord was born and raised in southwestern Saskatchewan in a little town called Lemsford, Saskatchewan. He completed his high school at Luther College in Regina and then went on to do a BSc. He then went to medical school here in Saskatoon, graduating in 1978. After that, he did a family medicine residency at City Hospital, where I understand he earned the nickname Warlord Gaydell. He then went to Hudson Bay with 2 of his classmates, Bill Code and Larry Sandomierski, and did family practice there for 5 years. After that, he came back to Saskatoon again and completed his anesthesia residency. He practiced anesthesia in Saskatchewan, Ontario for several years, and then developed an interest in pain management. He completed his FRCP in pain management, pain medicine, in 2016, one of the first offerings of that examination in Canada at that time. He now works in pain management at his Sante Surgery Center and Wardell Center for Chronic Pain Disease in Medicine Hat, Saskatchewan. Or Medicine Hat, Alberta, sorry. So without any further ado, I'll ask Gaylord to come up and give us his presentation on medical marijuana. Thank you.
This should be on now, right? Can you hear me up there?
Not yet.
Not yet, okay.
Use your outside voice.
Use my outside voice. Do I need to get close to this thing? Can you hear me up there? This thing's supposed to be working, you know. No, I've got a mic on. I'll do that. Oh, good. How's that? That's very good. Actually, it's good to be the first speaker in the morning because most people actually are awake, and that's a good thing. Although Dr. Bowie yesterday kept trying to figure out if we were awake by the subtle things he put on the slides. Anyone who knows me know that subtlety has never been one of my issues, so there's no problem there. So I won't worry about keeping you awake. Like many people of the left-handed persuasion, I have a little dyslexia. So when I get nervous, I tend to do kind of like yesterday when you talked about C54 and C45. And we do that a lot when we got a little dyslexia. So my first introduction part here, I'm going to actually read it because I think that's the only part that really is truly important in this talk. So what I would do is I would like to just say good morning and thank you. Thank you, Florence, and thank you to the organizers. It's a very well-organized conference and a well-needed conference. And I also want to thank my classmates because many of my classmates have given 40 years of their lives to the betterment of the health of the people of this planet, and I think that's very, very important. And I would also like to say that without this medical school, and I know we all have a love-hate relationship with medical school because we were there once, but without this medical school, that would have never happened. So I think that's extremely important to say. But one thing I want to say at the end, I grew up in southwestern Saskatchewan on a small, very financially challenged family farm. And without the good graces of the people of Saskatchewan and the funding that was provided by the medical bursary program at that time, poor boys like me would never, ever have had the opportunity to become medical doctors. So I reached my heart out to the taxpayers of Saskatchewan who made my profession possible and this medical school. Now, as I stand here this morning, in this crowd, I'm reminded of a couple of speeches that I've heard in the past, one that was very recent and one that was a long time ago. The one that was a long time ago was, I'm going to make this an apocryphal dean, but it was an apocryphal dean to a new medical school class. The dean was an ophthalmologist, so therefore clearly a man of vision. And I've paraphrased this a bit. He told those kids that they were the best of the best and the best of the very best, and they'd received an incredible gift to be there. And he also reminded them, not quite in these words, but there was a special place in hell for them if they disrespected or discredited that gift. He also told them that about half of what they learned would be wrong, and it was their job to try and always look for the truth. And at the same time, he urged conservatism in what we do and also moderation. The second speech was a little more germane, and that was the flight attendant yesterday when I was coming from Calgary. And I noticed that as she was standing there reading the safety features of the aircraft, almost everybody was texting, nobody was listening, nobody was paying any attention to what she had to say, but that information was pretty important. So I wondered, perhaps they'd heard it all before. Perhaps they'd all heard it before, and they already knew as much as they needed to know about what was on that safety card. Or maybe they just knew either the plane was going to crash or it wasn't going to crash, and they didn't have much control over that no matter what happened. Now, having studied a little bit of air safety and been an air safety officer for some time myself, I knew that it was far from true that there wasn't things they could do. So I'm going to go back 125 years, and we're going to talk a little bit about why it is that those numbers that are up there on that slide, I'm not going to talk much about my slides, so I'm hoping you'll read them, because I think in my world, it's better. I see patients every day, so I would much sooner talk to them than have them look at something. So those slides are up there for you. But we're going to go back 125 years and see if we can figure out why it is that there is such reluctance amongst doctors, right or wrong, to offer medical cannabis to their patients. And I might feel a little bit like that flight attendant sometime during this talk, but that's the way it goes. It's always said by people who don't remember history that if you don't remember history, we're bound to relive it. We don't know much about cannabis today. Doctors don't know much about cannabis, but if you talk to a doctor 100 years ago, those doctors would know a great deal about cannabis. When cannabis first came to England in the 1840s, Dr. Shaughnessy, it became widely used in medicine and was for a long time until the idea of herbal medicines kind of drifted away a little bit later. But great rumors appeared in Britain and in India about the terrible risks associated with this evil plant, the Indian hemp plant. The Indian hemp plant is the one we know today as cannabis indica, whereas the one that mostly makes hemp is cannabis sativa. But in reality, this is the one that they were talking about. So the British, in their own inimitable fashion, decided that they were going to study this. And they did a massive study, and it's worth reading, although it's hard to read. They did a massive study to determine if cannabis really was a threat to the British Empire. And actually, in the beautiful way that the British phrased things, the conclusion of this was that the moderate use of hemp drugs is practically attended by no evil results at all. So we often hear that there's no research on cannabis, but there's quite a lot. The next one was from an ultra-conservative organization, the British military, or the American military, pardon me. The American military was responsible largely for building the Panama Canal. Cannabis was widely used, not called cannabis, of course, it was called marijuana at the time. It was widely used by the soldiers and the people who were working on the Panama Canal Zone. And the British military, or the American military, was terribly worried about that, so they actually passed an army circular, it's called Circular Number 5, that made that completely illegal to do that. You could be kicked out of the military. And after a few years, someone said, hey, wait a minute, we haven't really seen any problem from this stuff. Maybe we should actually look at it. So they did a fantastic study, and this is a very large, well-done document. Again, after someone had knee-jerked and decided that cannabis was a dangerous thing. And they actually concluded that there were no ill effects, and in fact, they actually removed the restrictions, or recommended the removal of the restrictions, but of course, as in typical fashion, those restrictions never really did get removed. The next document, and there's a couple of pages of this, couple of slides on this one. Cannabis was made officially illegal in the United States in 1937. The act was called the Marijuana Tax Act, and it basically eliminated any possibility of using cannabis either legally or illegally in the United States. So the mayor of New York City at that time, who, if any of you have flown into New York City, will have flown into LaGuardia and will probably have read plaques about Fiorello LaGuardia. And he was a brilliant man. And he said, wow, this is terrible. We haven't had any trouble with this stuff in the boroughs of New York. What's going on? So he said, well, let's get a commission. So the New York Academy of Medicine was asked to produce a detailed report on the risks of marijuana to the social and medical health of the people in the boroughs of New York. And basically, they concluded that there was no risk at all. These three studies I have just highlighted, so we don't have to be here all day. I have a list in the references of a dozen similar studies, of which several of them were done in Canada, the 2002 Senate report on illegal drugs. The one that's most famous is the one that was done not long before I started medical school by Justice Ledane, called the Ledane Commission on the Non-Medical Use of Drugs. And as I look around this room, most of the crowds that I talk to are under 40. I see that there's quite a few people here over 40. So most of us will remember the Ledane Commission. And the Ledane Commission highly recommended the decriminalization of cannabis, because at that time they said there were so many people in Canada whose lives had been ruined by criminal charges for the use of marijuana. So if you look at things, if you look at historical data, there isn't any evidence for social harm, overall social harm, for cannabis. In fact, not only is there not any evidence, the evidence is overwhelming that cannabis hasn't really ever done any serious harm in the world. So even if cannabis is useless, even if it does absolutely nothing, the evidence for its vilification is really, really hard to find. Why there's so much opposition in the policing community, particularly, and the medical community for cannabis in general. So even if it's not bad, there doesn't seem to be any reason why we're so upset about it, because we don't seem to express the same kind of anathema with alcohol. We seem to tolerate that, although it is quite true that alcohol is a white man's drug, and there may be a little racism behind this somewhere, but I'm not sure. But it's really widespread belief that marijuana is really, truly dangerous and must be very tightly regulated and controlled. And that applies throughout. Most of the people in our society who are in charge, I guess that's probably the best way to say it, the people who are in charge. But yet when you go outside of this room and you go and look at the studies that have been done in the public doesn't feel that way. The public feels quite differently. The majority of the public, and in Saskatchewan, I believe the last number is 61% of the public supports the use of medical marijuana. So governments, policing, and the medical profession seem to be very much at odds with the public. Now, I often thought, oh, well, that's because we're a lot smarter than those other people. We're doctors, so we're smarter. But I've done a little bit of thumbnail research. Whenever I do talks, I ask people to tell me what they know about cannabis, doctors. And what I find is an abysmal lack of knowledge about cannabis by doctors. So I'm not sure we can buy the story that the reason why the paternalistic approach that because we're so smart, that's why we oppose cannabis. There isn't much evidence to support that. And the vast majority of doctors in all studies that have been done aren't happy with cannabis, even though in Canada, cannabis, after the Supreme Court decision in 1991, it took, well, governments are slow, it took 2 years to get the first medical marijuana access regulations to actually take place. And as you guys know, this city was where it happened. This city was the place. There was a little company here called Prairie Plant. And Alan Rock went to Prairie Plant and said, guys, we need somebody to grow this marijuana for us. And Prairie Plant said, okay, we'll grow this stuff. Does anybody remember where they grew it? In the mine in Flin Flon. Yes, absolutely. It was pretty cool. They used to fly their planes up there and bring that evil cannabis back here and then ship it to Montreal for radiation. It was pretty fascinating. So when you consider that, when taken as prescribed, there's never been a death from medical marijuana. There's never been a recognized death for medical marijuana as a result of the toxicity of marijuana. But yet, in North America, well, in Canada, we can give you some numbers for Canada, but in reality, there's thousands of people die annually from NSAIDs and acetaminophen, opioids, antidepressants, anticonvulsants, not to mention tobacco and alcohol, which I think most people would say that in terms of the world, tobacco and alcohol are probably the two most toxic legal substances that we allow people to use. So, in the interest of what was suggested by the dean at the beginning of medical school, I thought, why is this barrier? Like, what is the reason for the barrier? What is the reason? Should we at least try and look at it? And that's what prompted me to do this talk. And I have been researching this for about the last 2 or 3 years to try and figure out how it is that marijuana actually got to be illegal, and does that play a role in why we think the way we think? Because when it comes to the science of medical marijuana, yes, thank you. I'm relying on you to read this stuff, right? Yes. I work with a young lady by the name of Pam Squires, and she's a Saskatchewan girl too, who feels her job is to do the talk on one slide, even though she has 75. So she's a spectacular speaker, unlike me. So what do we know about cannabis? I mean, really, people don't realize how much we really know. The existence of a major signaling system. Now, the major signaling system, the endocannabinoid system, its receptors, and its implications for medical therapeutics have been known for at least 40 years. The endocannabinoid system is a larger signaling system than the endogenous opioid system. In fact, there are far more receptors in the central nervous system and the periphery for cannabinoids than there are for opioids. We have identified all the major ligands. So for those of us who don't remember what a ligand is the drug that attaches to a receptor, or the thing that attaches to a receptor. The receptors have not only been identified and mapped, but the receptors have been cloned. We can now build these things, modify them, adjust them. And obviously, a major system that's involved in signaling in the body clearly has benefits and risks medically, and a lot of research has been done. It hasn't been done in Canada, and it certainly has not been done in the United States, but a large amount of it has been done in Spain, particularly in Madrid, and a lot of it in Israel, particularly in Rafi Meshulam's lab in Jerusalem. So those are real facts. This is not kind of stuff like the people who tell you that, you know, marijuana cures baldness and marijuana will make your fingernails grow faster, and the people who also say that, you know, marijuana will turn you into an evil being just by smoking it once. These are real facts, and we know a lot about cannabis. So why is the medical application of cannabis and all of its elements, the cannabinoids and the terpenes that are in cannabis, why is it lagged so far behind? Why has that happened? These are simply the references to the previous 2 pages. Just before I finished high school, a very interesting book was written, and I didn't realize this book was written so long ago. I wish I had known it a long time ago. The book is called The Structure of Scientific Revolutions, and it was written by a man by the name of Thomas Kuhn. Now, he wasn't a doctor, he was a physicist. So Thomas Kuhn was a physicist, so clearly here's a man who knew what matters. So he looked at medical history and looked at the advancement of science in medicine and physics and biology and said, why do some strange things happen? Because the idea in medicine is that we learn a little bit, we add to that, we learn a little bit, we add a little bit. But yet, if you look back in the history, you see it took 100 years for people to realize that vitamin C could prevent scurvy. And it took a long time for people to accept that idea, even though it was known for 100 years. He looked at the conversion from the Ptolemaic view of the solar system to the Copernican view of the solar system. Why was it that for so many hundreds of years after virtually everyone who knew anything understood, or everyone who actually had a scientific view of things knew that the Earth was not the center of the solar system? Why is it that hung on for so long? And aside from the fact that Thomas Kuhn produced the concept of paradigms, which is probably one of the misused words in arts, almost used. I would say paradigm is overused as often as the phrase going forward. A lot of that stuff is misused. So briefly, I'm not going to talk about paradigms, but basically paradigm is just the structure of way we learn to look at anything. And really, it's very hard for us to do a good job of looking at anything unless we have a paradigm, a structure, a filter through which to examine it. And that was what this incredible book about the structure of scientific revolutions, he talks about paradigms. But one of the things that he found in looking at this stuff was that the paradigm development and paradigm slowing down can happen for reasons that have nothing to do with science. That many times science is either advanced or retarded because it happens to have one or two powerful advocates who stop the development of the paradigm, even though we know better. I mean, all one has to do is look at the theory of evolution and see that there's huge competing political views, theological views about the paradigm of evolution and the concept of natural selection. It was also true for the center of the universe, the center of the solar system thing. It's been true for many, many, many things. So he said that we can have powerful, powerful advocates. So he fomented this idea that personalities in politics play a large role in science. And I honestly wish that this book was on the curriculum for everybody in medical school. I wish I had read this book when I was in medical school. Aside from simply being told by the dean that half of what we learned was wrong, it would have been very nice if I had understood that what we are taught in science is largely directed by politics, religion, and many, many other things. Although Max Planck understood it, if you if you read the little thing at the bottom there, he said the solution to this problem is just let the old people die and it'll get better. Cannabis was legal medicine in the United States from 1851 to 1941. It was in the U.S. pharmacopoeia simply as a medicine along with many, many, many other medicines. William Osler considered it the primary treatment for headaches. There were many, many uses for cannabis at that time. But the cannabis was a medicine. It wasn't smoked marijuana. It was cannabis. So cannabis was legal medicine until 1941. So I've started asking myself, well, wait a minute. It was legal medicine from all this time. We know how some drugs got illegal. Like some drugs got illegal because they killed a lot of people. Alcohol, tobacco, morphine, heroin, cocaine. These drugs got illegal because they legitimately killed people. They were very, very dangerous drugs that really needed to be in the hands of the medical profession. So what happened with cannabis? How did it get to be illegal? How did we go from the idea of cannabis as a clinical medicine to this thing? Like, how did we get there? How did we go from a weed with roots in hell? How did we get that? How did that happen? And that's what this little talk is about. I don't want to sway you. I want you to look this up yourself. But I assure you that when you look this up yourself, you're going to find that what I'm saying is documented. It's in the archives of Congress. It's in the archives of Harry Anslinger. This stuff is all there. This is not some guy who's saying, oh, well, you know, we can cure anything on earth with cannabis. Cannabis is just another compound. But what is very strange is how cannabis itself, that particular compound, how that particular compound got to be so nasty and illegal. And it's very complex. And it really started out with anti-Mexican racism and ended up with anti-Jewish racism in the well, this was, you know, that was Nixon, right? Well, you guys remember who Haldeman and all these guys were. They were the guys who brought us Watergate. They were a great bunch. But I do want to talk a little bit about Canada, because Canada's a little different in terms of how it got illegal. We know in the United States, we've got a pretty good idea how it got to be illegal, and I'm going to talk about that in great detail, so hope but in Canada, it was pretty weird. In 1923, there was a bill on the order paper in Ottawa to make all these fairly addicting drugs, like opium and cocaine and morphine, to make them illegal, so they could only be handled by doctors. They couldn't be used publicly. They couldn't be sold unless you had a license to sell them. And a couple of days before this thing got to the order paper, somebody wrote in cannabis. Catherine Carstairs did a huge study on this. She wrote a book on it, and we can't find how that happened. We do not know how it happened. We don't know how cannabis got added to the order paper. There was no debate, there was no justification, and in fact, when the Senate committee looked at this in 2002, they found that in fact almost no one in the Parliament, the MPPs, almost none of them, the few that were there for the vote, had any clue what cannabis even was. So how did it happen? One of the theories is the Janie Canuck theory. Now, Janie Canuck, AKA Emily Murphy, is a very famous Canadian. So I know Dr. Pierce got in trouble yesterday for going after women. So I'm going after an individual here. This is not anything to do. So I won't, whether Janie Canuck was a woman or not, I don't think makes any difference. In the period up until 1923, this lady ran a series of columns. Now, she's a famous lady. In 1916, she became the first magistrate in the British Empire that was a woman. I mean, she was a huge Canadian icon for women's rights. She's a member of the famous Five that includes Nellie McClung and a bunch of other people. So she's a very famous woman. So what was the deal here? What was her connection with cannabis? Well, it turns out Emily Murphy was not exactly what we think she was. For several years before 1923, she ran a whole series of articles in Maclean's. And I believe that today we would call those yellow journalism. The whole purpose of these articles was to complain about how immigrants were diluting the white race, the problem with she was particularly concerned with the Asians. She was particularly concerned that the reason why they brought drugs in here was to cause degeneration of the white race. So she believed that the contamination of the genetic material of the white race. And it's interesting when you look at Janie's record, or Emily's record on the bench in Alberta, she supported residential schools. She supported disenfranchising Chinese women from the vote. She supported the eugenics movement, which involved the sterilization of people who weren't quite as bright as Janie. So she was a bit of a nasty piece of work, despite the fact that she's a Canadian icon. And there was a lot of panic in society at that time about the immigrant population and what they were doing to the white Anglo-Saxon Canadian population. That was a big panic in those times. And it is not unreasonable to assume, since many people read Maclean's, most of the people who read Maclean's were probably the people who would vote on this bill, and the fact that she then went on to write a book called The Black Candle, and I would highly recommend you read it, that to a large point, there was a very powerful advocate for the illegalization of many drugs, of which marijuana, in fact, in her book, The Black Candle, there's actually a 7-page chapter specifically on marijuana. So one wonders about that as a possibility, though again, there's no clue how it happened. There's no clue as to how cannabis actually got on the order paper and became illegal in Canada. Another fairly prominent theory has to do with the Canadian drug guru, drug czar. His name was Colonel Sharman. He was in the Northwest Mounted Police and then the British Army. He was in South Africa in the Boer War. And then he came back to Canada and became in charge of narcotic control in Canada. And that theory has been proposed, except that he didn't become the narcotic czar in Canada till 1927, and this happened in 1923. So I'm not exactly sure. The other thing that we do know about Canada was that in cannabis in Canada, in the 1920s, nobody was interested in cannabis. Hardly anybody knew about it. So we're not quite sure what the pressing need was to make it illegal. And in fact, it was such a horrible thing that when it was made illegal in 1923, it wasn't until 1932 that the RCMP actually seized 8 cannabis cigarettes, marijuana cigarettes. So it's quite clear that it wasn't from public pressure, and it clearly wasn't, as we've shown you plenty of evidence that it wasn't from a ton of people dying. It does appear it was rooted in the social milieu of the day, a tremendous racist idea because the cannabis in Canada was associated, the term was used, it was spelled Hindoos. Those were the major people that used cannabis in Canada back then. They were referred to as the Hindus. And that really was anybody who wasn't yellow or wasn't white, and they weren't a Negro. And that really was the largest group. So it appears that that's what happened. I do think, though, the prohibition movement, which started in 1830 in the United States, the prohibition movement of alcohol was very, very powerful. There was a huge connection between the two powerful advocates of marijuana prohibition. There was a huge connection between those two individuals, Emily Murphy in Canada and Harry Anslinger in the United States, and an organization called the Women's Christian Temperance Union, which was largely a female white supremacist group. And that unfortunately played a huge role, and they had a huge political connection at that time. And actually a lot of their stuff was pretty similar to the other organization that was around at the same time, the KKK. So the connection between the Prohibition movement, the 18th Amendment between 1920 and 1933, which brought about Prohibition in the United States, is very hard to discredit. Was it Pierre Elliott Trudeau who said that living next to the United States is like sleeping with an elephant? Was that Trudeau that said that? Yeah, I think sleeping with an elephant. And I think someone else said that when America gets a cold, we get pneumonia. And I do think that the American connection is probably fairly important in this whole issue. Let me see here. There we go. In America, of course, the story is much clearer because the Americans have kept really, really good records. Our records weren't so good. So in America, the social locus plays a huge role. The Mexican Civil War ended around the end of the 1800s, early 1900s, and millions of Mexicans were displaced and came north into the southwestern United States, where they were not welcome. Hasn't changed much, but they were not welcome. And there were very powerful police, publicists, politicians who were very happy to be malleable with the truth to produce a climate where the Mexican immigrant was vilified. Now, the one thing that set the Mexican immigrant apart from the white American was marijuana. And very few Americans had, like Canada, very few Americans had any idea what marijuana was. They were pretty familiar with cannabis because it's been a medicine for many years, but they had no idea what marijuana was. So it was very easy politically to attack the Mexicans and blame all of their drinking, all of their crime, all of their laziness, all of their bad attributes, which were so well publicized at that time, on cannabis. The next thing that also happened was Kuhn's idea of a single powerful advocate that took over, and that person was Harry Anslinger, and we're going to talk a little bit about him because he played a big role because he controlled the entire drug system in the United States from 1930 to 1962 for a long time. Then, of course, there's the progressive movement and the prohibitionists. The other thing that plays very large into the cannabis thing is the Flexner Report. Is there anybody here who knows what the Flexner Report was? Somebody put up a hand. There's a hand up there. Flexner Report is one of the most important documents in the history of medical education in North America, perhaps the world. The Carnegie Institution, at the request of the President of the United States, hired Abraham Flexner, who was an educator, to determine why medicine in North America, medical education, was so bad. And of course, it was pretty obvious why it was bad, and his report was spectacular. And what he recommended was, first of all, that the number of medical schools be reduced dramatically. He also recommended that medical school teachers be given tenure so they had security. He recommended standardized curriculum. He recommended the application of the scientific approach or the scientific method to medicine. And he advocated the use of single agent pharmaceuticals as opposed to mixed drugs like cannabis and a lot of herbals, which, as you know, the US Pharmacopoeia, that was pretty much the way it was done then. So he made a huge change in medical school, and that very well did play a role on the lack of interest in all medicinals, not just cannabis. So those things are very important. So let me talk a little bit about Harry Anslinger, because most people who've studied this in great detail now realize that what happened with marijuana was largely irresponsible to this particular guy. Now, he wasn't just an average guy. his wife's uncle was Andrew Mellon. And Andrew Mellon was intimately connected with the Democratic Party. He was intimately connected with the Republican Party. But more than that, he was intimately connected with the industrial elites of the United States. He was on personal terms with Edison and Ford and DuPont and people like that, and Hearst, and all these people who became very powerful advocates for the abolition of cannabis and marijuana. So he was intimately connected. The next thing is, he was a policeman. He started out as a railway cop, and then he became a cop in the prohibition world for the Federal Bureau of Narcotics, and they were responsible for the single entity, prohibition. They were responsible for that from 1920 to 1933. And has anyone seen the PBS documentary on prohibition? It's fantastic. And one of the things that I got out of that was that it was prohibition that really, really solidified organized crime in the United States, that it was very, very important for solidifying organized crime. So here was a guy who not only was he a powerful policeman in a very respected organization, the Federal Bureau of Narcotics, of which he actually became the commissioner in 1930. The Federal Bureau of Narcotics is today's DEA. They changed the name some years back to the Drug Enforcement Agency in the United States. But this man was an odious, nasty piece of work. When you get a hold of his stuff, his archives are available in the United States, and you can get them online and look at them. And the things that this guy said and believed were terrifying. They were very much like Emily Murphy. Reefer makes the darkies think they're as good as white men. Primary reason to outlaw marijuana is its effect on the degenerate races. But you know, the hardest part for me was they hated Jerry Bowie. He hated Jerry Bowie. And he hated Jerry Bowie because Jerry Bowie's a jazz musician. Harry Anslinger genuinely believed that the entire jazz genre was due to cannabis. It was quite amazing. He hated jazz musicians. It's also very strange. He looked an awful lot like Benito Mussolini. It's kind of odd. So let's go to the actual story of how this happened. The Pure Food and Drug Act was one of the best acts of the American government because prior to 1906, the adulteration of food, the adulteration of drugs was a horrible event. There was also an identical act with almost the same wording for meat, but I only put this one here because people were dying from horrible meat. So they put this act together and they said, look, there's also a bunch of drugs that should never appear, that should never be in a medication unless they're described on the label. So these 10 drugs, of which one of them was chloroform, all of these drugs that are on there are lethal. All of these drugs have killed people, except for cannabis. The other thing about cannabis is you can find the reasons in the lead up to this act. You can find out how all those other drugs got to be there, but you can't find out how cannabis got to be there. It's a little bit like Canada. Nobody quite knows how cannabis got to be there. However, what it did established in 1906 that cannabis was a poison. Now, the next thing that happened, and when I read this, it terrifies me. And it terrifies me because prior to 1914, if a doctor had a patient who was dependent or what they called addicted in those days to opioids, they were allowed to continue them on that legally and allow them to continue to work and function. In 1914, with the stroke of a pen, 200,000 people in the United States and their physicians became criminals. And a large proportion of them went to jail, including the doctors. The second thing the Harrison Tax Act did, which was very strange, is it put the control of drug abuse and substance abuse disorder, as we call it today, in the hands of tax collectors and policemen instead of health and welfare folks like us. So Anslinger became the commissioner of the FBN in 1930. In 1934, his life fell around him as prohibition disappeared, and he had nothing left for his organization to do other than the little bit of work they did with opioids, and it wasn't very effective. So Anslinger, who had supported cannabis up until then as being not a really threatening drug, and he said it was really kind of like dandelions, they're everywhere and they don't really hurt anybody. And again, that's well-documented stuff, I'm not making that up. And so he started in 1934, and he did something very interesting. He instructed his agents to go throughout America and find stories where some horrible crime, death had occurred in which cannabis may have been involved, and to tweak those stories to make cannabis the guilty party for this. Very, very similar to the tweaking that's been done with opioids. There's literature to show that 80% of the people who become addicted to opioids started their opioids with a prescription medication. What is not said is that 90% of those 80% took either a stolen prescription or an illegal opioid prescription drug. It was not a prescribed to them. It was a prescription drug that was a legal prescription drug, but it was stolen. It was illegal. So again, another way to do it. So he decided that one of the great ways to make cannabis illegal, since it really hadn't done any harm to anyone, they had to make it appear that it did harm people. So what he did is he got these agents and he created a document, and the document was called the Gore Files, of which there were 200 stories. These studies have all since been researched and found to be all nonsense. Cannabis never played a role in any of these issues. But I also like to say that Harry Anslinger was the father of evidence-based medicine. When he was required to testify or to provide evidence for the Marijuana Tax Act in Congress, he sent letters to 30 doctors, prominent doctors in America, said, hey, what's the story of this cannabis? I want you to tell me this stuff's really terribly dangerous, and should there be a ban? And 29 of them wrote back and said, nope. He picked a single guy, and that's the guy that went to Congress. So, you know, good. Medicine, evidence-based medicine's been abused for a long, long time. And then the press, of course, used the Gore Files, of which the worst one of all was Victor Licata's axe, and we can talk about that. It was a 15-year-old kid who killed all his family with an axe, and it was blamed on cannabis, and later when they looked at it, there was no evidence the kid had ever used cannabis, had ever even been near cannabis, but that's what they did. He also did a number on the American Medical Association. The day after Anslinger's doctor testified in Congress, the American Medical Association sent their counsel, and that was a Dr. Woodward. They sent their counsel, and his testimony is fascinating. You should read it, because the first thing he said was, they never asked us about this. We've never heard about this. Like, what is the deal? We've never been told anything about this stuff. What's going on? So he said, well, we think this is crazy. We don't have any problem with marijuana being illegal. That's a recreational drug. It's a mongrel term, smoked by people. But cannabis, which is a legal drug, should be left alone. And it wasn't, of course. They passed this act, and almost no one in Congress at that time had a clue that cannabis and marijuana were the same thing. It's interesting when people go into the Freedom of Information Act and they look at stuff that people did. Anslinger was a masterful liar. Part of his reasoning for the Marijuana Tax Act is he said to Congress that he wanted the right to do the same spectacular job he'd done on opioids in the 1920s. And later, after this man was gone and we got to look at it, we found that in his articles, he admitted that those were all fabricated, numbers, that he made them up, kind of like we've seen with Lyrica research and a lot of other stuff. It's really interesting to see how evidence can be manipulated. So I'm just gonna, I got 10 minutes left, right? What's that? I go, okay, 10 minutes left. You know what? I could spend the next 10 minutes going through what we know about cannabis and what we know. And what we know about cannabis is very little. And the reason why we know very little about cannabis is, first of all, in medical school, when cannabis came up, it was, well, that's an illegal drug, so we won't talk about it, let's move on. And I think the other reason that's really, really important is that somehow people have got the idea that the absence of evidence is not evidence of absence. Even Chuck Rosenberg, who's the head of the DEA, said, you know, we're going to keep marijuana as Schedule 1 because we've decided it's Schedule 1. And the really thing, anybody ever see Heller's book Catch-22? Remember Milo Minderbinder? And it's an interesting Catch-22 with cannabis. It is illegal as a Schedule 1 drug. And since we are unable to study it, we are unable to determine that it shouldn't be a Schedule 1 drug. It's a fascinating, crazy amount of information. But what we do know about cannabis is that at least the National Association of Science, Education, and Medicine in the United States has determined that cannabis is actually useful for 3 things: chronic pain, cancer, chemotherapy, and I don't remember what the third one is. But it's just only about 3 or 4 things, because that's all we've really been able to study. So that's all we can kind of legitimately say about it. Just as the same thing with cancer, you know, every time you turn on Twitter or Facebook, you see, oh, well, cancer cures, cannabis cures this, cannabis cures that. No, cannabis only does that in tissue cultures and in vivo studies in animals because we have not been allowed to study it in human beings. So we don't know much about cannabis in the sense that where we talk of evidence-based medicine, simply because we have been unable to accumulate the evidence. So in summary, what I would like to say is that whether you support cannabis or not, that's okay. But you should support it or not support it based on some reasonable understanding of how cannabis got to become illegal. And most of the people that I talk to say, listen, they didn't make cannabis illegal because it was a good drug. They made it illegal because it must have been something horrible. There isn't a shred of evidence to show that. This seems to be the only compound that we have, well, except alcohol and tobacco, would seem to have been made illegal in spite of, or made legal in spite of massive amounts of evidence to show the toxicity, lethality, and social harm. Cannabis, there's no evidence for that, for cannabis. There's lots of evidence for it for the opioid drugs and cocaine and its relatives, but there's MDMA and ecstasy and LSD, but there's no evidence for cannabis having become made illegal because it was some kind of a horrible drug. And I think that was the reason, the motivation for this talk was, I'm neither pro or anti-cannabis. I will tell you in my practice, 1 patient in 5 gets a decent result out of cannabis. That's pretty similar to what I see with opioids and anti-epileptic drugs and cognitive behavioral therapy and surgery and just about anything else we use in chronic pain. It is not spectacular, but it is also far less harmful than any of those other things that we've talked about, except cognitive behavioral therapy. And apparently recently people are questioning that, but that's another story. So I would like to again thank the committee for inviting me here today. And I realize this is a very controversial topic, and I actually gave this talk 2 nights ago in Alberta, and I almost had to get a guard to get out of the room. For some reason, this was seen as a tremendously pro-cannabis talk, and that was not something I should have been doing. So I'd like to thank the Alumni Association and whoever it was that had the courage to invite me here. So I am willing to try and answer questions, although many of the questions that we asked have no answers. Thank you very much.
I'd like to thank Dr. Wardell for his history lesson. The one thing I didn't notice was any conflicts of interest. So I think it behoves me to ask Dr. Wardell, is he a member of the Liberal Party of Canada, and does he know Justin Trudeau?
No.
No.
Actually, I'm a card-carrying conservative. I am in complete opposition to my brother. He and I are on opposite sides of the spectrum. So, no, I am not I am a card-carrying conservative. I'm from Alberta.
I guess the other conflict of interest these days is I should ask him how many shares he has in marijuana companies listed on the Canadian Stock Exchange.
Now, I know that you were sitting in the corner. Let me put this up. I'm going to do it again. Just a minute. I have to do this now because it's very funny because this exact same thing happened to me when I gave this talk the very first time in Medicine Hat. So first of all, I went through all these disclosures because I think nowadays it's absolutely critical.
Thank you. We believe you.
That was very good.
Any questions for Dr. Wardell? Bob?
Dr. Wardell, I was wondering, epilepsy seems to be one of the conditions of young people or older people, I guess, as well. Is there any evidence that the use of cannabinoids in epilepsy is not very good? I've had people tell me that this is one of the best routes to healing.
So
epilepsy.
That's a great question. When I left for China in May, just a couple days before I left, the FDA they had a special committee on Epidiolex, which is pure CBD, 100 milligrams per mil, and they had 3 studies that strongly showed that Epidiolex was of value in 2 extremely severe terminal epilepsy diseases in kids, Dravet's and the 2 of them anyway, Gesto, Dravet's and Gesto. And they said they're going to fast track Epidiolex because the results of these studies, despite the fact that the cannabidiol that was in there was made by a plant, so it was a Schedule 1 drug. Despite that, they were going to see if they could figure out how to fast track this and bypass the Schedule 1. Now, THC, in fact, may make some forms of epilepsy worse. One of the biggest problems with cannabis is like many other, cannabis is very much like anesthesia. Anesthesia is not a generic. So when you do anesthesia, there's components, many components to an anesthetic, and every anesthesiologist has to adjust those components. Cannabis is a lot like that. There is huge different things that are in cannabis. So that's such a great question. I think if you take a very high CBD compound, it's probably going to turn out to be quite efficacious. But if you take cannabis as a generic, probably not at all. And that's not a very easy answer. I know it's like asking somebody what time it is and they tell you how to build the clock, but no, yeah. Does that help? Yeah. So no, I don't have any money invested in the cannabis industry.
So Gaylord, thanks for the talk. You must admit that the cannabis or marijuana, whatever you want to call it, nowadays is way more potent than the hippie day, back in the '60s type of. It's been tweaked, it's been modified genetically perhaps, or selectively. Much like, for example, rapeseed oil was toxic at one time for human consumption, and now basically it's become canola, which everybody uses for everything, oil product. It's been tweaked, and that's where maybe some of the harmful effects maybe in the younger people It's not maybe as safe because of this, and it may have more influence or detrimental effects on our younger recipients of trying this drug.
There's definitely anecdotal evidence to suggest that the prolonged use of high THC compounds, particularly the stuff that's called skunk, although I don't like using those terms, is connected or associated with an increase in psychotic symptoms, especially in young people, but it can occur to some extent in all patients. I had one patient who developed an acute psychosis that may have been associated with cannabis. The only reason why we say may, because he was getting his cannabis in Mexico, and God knows whether it could have had other things in it. That's one of the problems with illegal drugs. You know, it's like when you were a kid and your mom said, you know, be careful who you play with. Well, when you're buying an illegal drug, you know, be careful who you're playing with, because you just have no idea what's in it. But I think that we don't have sufficient evidence right now to even vaguely suggest that recreational cannabis, I don't support recreational cannabis anyway, but recreational cannabis should be used in people under the age of, well, apparently we're going to have to be stuck with what we're stuck with, and that's 18. I think most of us would have said recreational cannabis at 25, although we're not exactly sure when brain maturation is finally done. I think it might be finally done in some people at age 13, but in other people it may never, their brains may never mature, and I think those are the great people from what I can see. I don't know, does that help anyway, Berwin?
I think comparing, when your talk says, you know, there was no signs of detrimental effects, perhaps, or I think we're talking sometimes two different products. Nowadays, very high THC level cannabis, and maybe what they were studying 30, 40 years ago, maybe it's not quite apples and apples. There might be more apples and oranges.
And I don't think anybody would argue with that. And I think you're even seeing in Colorado now, you're seeing a movement towards trying to, see, we can't regulate illegal cannabis, and that's the problem. We have no chance to do with that. You know, so many people are using cannabis, and so many people now are getting it from the street, and a lot of that stuff has been genetically modified either by devious means or just by breeding, whether you're a GMO antagonist or not. But you're right, but that isn't the issue. I think the issue is should we have this drug to the point where it's out in the open, so at least we can do something with it.
I think I have time for one more question in the back. John?
John Connolly, class of 78. I have to ask a 78 question. In terms of delivery routes, can chronic use of inhalational marijuana, i.e. smoking it, lead to COPD, similar to what we see with chronic tobacco use with smoking?
Wow, that's a great question. Unfortunately, I had a couple more slides here, and one of those deals with the issue of what is the effect of smoking cannabis on the lungs. And this is actually one of the things that's been very well studied, because as you know, the National Institute of Drug Abuse in the United States has freely allowed the study of cannabis, provided it was a study that wanted to show harm or detriment. They would not put a penny into any study or provide their cannabis for any study in which any component of it suggested a benefit from cannabis. So there are a large number of studies on exactly what you asked. So that's one of the few things where. So one thing that was really strange is that in people who only used inhaled cannabis, the incidence of lung cancer was no different than people who didn't use cannabis and didn't smoke cigarettes, provided they didn't smoke cigarettes. But the incidence of chronic obstructive pulmonary disease, the incidence of bronchitis was basically every bit as high as it was with tobacco. And that's what the actual study showed. And these are not little studies. These are studies that have been done and financed, and the National Cancer Institute has been involved in them. And in fact, a lot of this stuff has been reported in the American Pulmonology Journal. It's really quite fascinating. Exactly why smoked cannabis doesn't cause an increase in lung cancer is absolutely confusing to everyone. We know that cannabis cells through the PPAR system cause apoptosis in cancer cells. But to me, that can't explain why the carcinogens that are produced by burning anything, whether it's tobacco or rubber tires or cannabis, why it doesn't cause an increase in cancer. But these studies are really quite amazing. So there's something weird about cannabis when you use it alone. But if you add cannabis to tobacco, then all the risks apply. And it's exactly the same thing with driving. Cannabis does not impair reaction time nearly to the extent as alcohol does. But if you add it to Zopiclone, you add it to Ativan, you add it to alcohol, the results are spectacularly worse. So that's a problem too.
Gaylord, there was a study, I wanted one more question. There was a study on airline pilots. They basically took a group of airline pilots who had to be assessed for their capabilities as pilots. And as the second part of that, which they did, and they passed, 80, 90%, whatever, on the simulators, they were given cannabis. They smoked it. 24 hours later, they tested them, and more than 50% of them crashed their simulators. 24 hours after. You cannot say there's not some prolonged effect and impairment in these situations. And this study was just recently done, and it's scary.
And I don't think, because I actually have read that study and a couple of other similar studies. I didn't say that. I certainly did not say. Here's a problem. When you study, remember what I said about cannabis? Cannabis is like anesthesia. If you say to somebody, well, I had an anesthetic and I had a headache for 3 months. So if that patient had a general anesthetic, you're not going to attribute that to a post-dural spinal headache, right? You need to know what the cannabis was. You need to also know a lot more information about what that strain was. There's 3,400 cultivars. They have very different terpene levels. So you don't really know. The half-life of THC is 7 full days. So to get it down to 5 half-lives, to get it to the point where we could say it's pretty much zero effect, and that's the way most of us say 5 half-lives, you're looking at 35 days. So I don't think you're going to find anybody who knows anything about cannabis who's going to say that there's no evidence for the long-term effects of Sparrow. It's like pentothal. Pentothal can affect people for a long time. We know that the half-life of Valium kind of roughly equivalents to the age of the... All I'm saying is that we don't have any reason to be more concerned about cannabis than we are about alcohol.
Yeah. Thank you, Dr. Wardell. Very interesting topic, and we make sure that you stick around for coffee break because it sounds like there's more questions out there. So, I should have pointed out that Dr. Wardell was giving the 13th annual Clara and Frank Gertler Lecture in Medicine, and we'd like to thank them for their contribution. Our next lecture is